after this, people think that our psyche located in our heart. In this time in Africa, all society, all people think same of this, that our psyche located in our heart. And what happens with Christian Bernard? This black man took the heart with psyche, from one person and transplanted this to another. What's the problem? The problem of transplantation mention a psyche from one person to another. What happened? What feels this patient with another psyche in body? And the previous questions what created this situation, that if this heart work from this people living, if heart work, it's same that psyche continue to live, and Christian Bernard kill this patient. What's the situation? In hospital where Christian work, they have a patient with heart failure. It's a genetic problem when the muscle of heart not strange, and the heart from working increase her size, and this working not good. The blood after systole put out in the heart, and patient have problem with circulation of blood in body. It's named heart failure. And Christian understand this. We have auscultative symptom of this when clapper of heart increased and blood not circulating in our body. And in this hospital, in this time, come another patient after car accident with damage of brain. Christians see this and they think that this patient is die because they see that the brain was damaged, and Christian was take this decision. It's another great problem of bioethics, because in this time we doesn't understand the criteria of death. It's important when we see a body with clinical death, for example, and we must examine this body and understand it's have a live or this patient is die. Today we have this criteria, we understand, and one of these criteria is electroencephalon activity of a brain. And this multi-operators in emerging agency have this channel when we examine how the brain work, and constitution of constitution of living in this organ. In this time we doesn't have this criteria, and Christian have a problem of this. Society said that this man killed one citizen of our city to have a chance to continue life for another. And who Christian Bernard, who is it? It's a man or it's a God? What questions? Because only God may do this, took the psyche from one person or take this to another. Yeah. What the problem, what ethic problem of this situation? Yeah. And in first part of our lecture, I tell about technical progress and ethic progress. And on this case, you see that technical progress very grows in this situation, and Christians do this operation, but ethical standard stopped this progress because we in our mention we doesn't understand some ethical aspect. Yeah, criteria of death, where located our psyche, who must take this decision about transplantation of heart. Yeah. And it's transplantation is very cute branch of medicine, and we may tell about this in our lecture. Yeah, in a break I see. Oh, it's important information, please. Oh, dear students. Yeah, one. Oh, I see all of us. In our schedule, I see there's one mistakes in our schedule. Today I start first lecture in morning at 8 o'clock, but in your schedule you have this lecture in 25 of January. Yeah, yeah. And be attentively. At Tuesday we doesn't have a lecture of bioethics at A, because today we have a 2 lecture. Yeah. Okay. And our next lecture of bioethics start in your schedule and 26th of January and half of 12. Yeah. And all schedule is right. And I see 9 lecture, and think that we tell about 6 lecture about common questions of bioethics, and we have a 3 lecture to separate part of bioethics, and one of this it's transplantation. We tell about this, and it's a cute questions of our practice. Yeah, and this example of this. Yeah, when ethic stopped the progress in medicine, and I doesn't write to a future, and we tell about this in next lecture. Yeah. Okay. What do we need bioethics? Why do we need bioethics? Yeah. And it's we collect any historic fact, any serious case in medical practice, and account of this information ledger, and in 1970, yeah, we was stay on this step when we must collect this, understand this information, and this person, it's name of one Ransler Potter, in 1971 create a new science, a new branch of knowledge, and Potter named this bioethic. Yeah? Named this bioethic. Yeah? You see that it's a new discipline located at the cross of classic medicine, some aspect of theology, yeah, politics, some life science, laws, it's important, and philosopher. Yeah? And bioethics located on this knowledge. Yeah? Bioethics includes ethical issues related to all branches of knowledge, including the environmental, life science, and medicine associated technologies. Yeah, reactive response. Sometimes we see this term. Yeah, and it's important part about cultural pluralism. Yeah, we stay on this ethic norm and feel acute of this when we come to another country, another culture, and we have some problem because in your country we have some standard of communication, and in another country we may see some difficulties of this. Yeah, and in Russia, you may feel this. Our in most population, our psyche is inside, yeah, introversion psyche. It's aspect, historic aspect. We Russian population live in a huge area of country, and we communicate with each other not more time, and we feel good when we stay alone and think about any big problem in our mind, and we feel good on this situation. Yeah, for example, in cultural aspect, and this time I come to coffee, and when I work in our corpus, one students, Arabian students, come to me and take questions from her schedule in telephone, and it's very simple from her, but not good for me, and I help us, but we feel this because in some countries communications is extraversion communication. In Indian, for example, yeah, I know that all students of this in your culture it's normal when we communicate from face to face. In our culture it's not comfortable from our, and it's our individual aspect of human, and bioethic include this aspect because we start to communication with our patients in hospital, for example, from teachers. It's one aspect of this. Yeah, you see some common word about bioethics, and this definition of bioethics. Right, this it's a good definition of our knowledge. Yeah, bioethics is a subfield of ethics applied to the life sciences. Yeah, life sciences. Yeah. The discipline of bioethics help us as a society make decision about how best to use new scientific knowledge. Yeah, how to make policy decisions regarding medicines or treatments, and how we should behave with each other. Yeah. Communication, treatment, problem include some ethic aspect of this. Yeah, it's bioethic. It's definition of bioethic. Yeah, it's discipline help us to create a good answer to acute, acute questions on decision in our practice. Yeah? And this fact of our history said that it's a good practice. Yeah. Look on this, and you may know that in the historic of medicine you hear about medical ethics. Yeah, we have this aspect, medical ethics. Yeah, what the definition between bioethics and medical ethics? Yeah, you see in slide this information. Some link to. Yeah, bioethic, it's across its discipline, across it's help us to communicate with another part of society. It's not only medical discipline. It's discipline including in government, in laws, and in some philosopher understanding of living lives. Yeah. In this field, in field of bioethics, classically, in most university, this discipline read by philosopher cathedra. Yeah, and in Ulyanovsk State University, it's one of achievement of your education. We took this discipline on medical university, not in philosopher cathedra. Yeah, and in our cathedra, it's integrative cathedra. Our cathedra named is medical psychology, psychoneurology, and psychotherapy. Yeah? It's our cathedra. Yeah? We come to us in third course and in 5 course. Yeah? We have a discipline on first, third, and 5 course. Yeah? We have an integrative function, and I think it's achievement because when a teacher have a practice in medicine, when we see the death, when we try to help our patient, when we see the moral problem, we have your experience of this, and it's not only theoretical branch of knowledge, it's a very practical discipline. Yeah? And I am a neurologist in practice. Yeah, I am a doctor. I am a neurologist. I work in my profession and teach, working by a teacher in university. Yeah. And it's good practice when this aspect prepare doctors and not a philosopher. Yeah? Because this discipline across only in medicine, and in some university it's separate in philosophy. Yeah, and medical ethics, it's a one branch of bioethics, yeah, because how we communicate with patients, how we communicate to each other with doctor-doctor communication, how we communicate with our chief, yeah, it's aspect of medical ethics. The bioethics have many wide area of thinking. Yeah? And what of this? These are main topics in bioethics. Yeah? Please, photographer or screen this point because we have some question and tests. Yeah, if we have a test in our credit, it's one of these. Yeah, it's main topics in bioethics. Yeah, I tell something about this death and dying. Yeah, in Christian Bernard case, we understand that it's important. What the time when we said that it's patient die, yeah, criteria of death. Yeah. Today it's oh, I see next slide. We tell about this on next slide. It's not simple question. Yeah, when we take part with vegetative status. Yeah, you may here you right you see in some serials this situation when many years some people lay on a hospital with artificial lung function and we doesn't understand come to a conscious this patient or no. Yeah, some from this example. Yeah, the next pre-birth issues. Yeah, it's one of our term. What we must doing when in pregnancy we investigate the pregnant woman and see some pre-birth problem. Yeah, some genetic problem, some damage of some organs, and what we must do of this. Yeah, it's not simple questions. Yeah, the next issues in human reproduction. It's very hard questions because I tell about this something because we doesn't have in practice this term issues in human reproduction. What I know about this. Today we have a technology with a simple technology and we may transform a genetic material of human. It's not very difficult technology. Yeah. But we have a moral standard block of this investigation because in all countries the genetic transformation of human it's not legal. Yeah? But in the case of 2090 only 2-3 years last of year we have this case when great China scientist publicate in Facebook message that I do a genetic transplantation of a human twins. Okay? And these scientists describe situation. In our knowledge, we know that we have a genetic variability of устойчиво sustainable from HIV infection. Okay? Some people have this gene and have sustainable immunity states to this infection. And this gene interaction with IQ, okay? A high level of IQ. Okay? And these scientists include this gene in a human embryo because mother of this embryo, infected by HIV, and mother take a help of these scientists to have a chance that her future child doesn't disease infect of this disease. Yeah? It's simple to understand, but it's a China scientist, and all our medical society doesn't know what happens next. Yeah, with this scientists, nobody know what happened with these scientists today. Yeah, and what happens with it may be fake, but this great China scientist, he known of genetic scientists of another country, and we have ethic problem of this area. Yeah, issues of human reproduction. Another aspect of human reproduction is separate of gender of embryon. Technology take opportunity to this in this time, but we have a block of ethic and legal in this situation. Yeah, and you see the next questions about human cloning. It's same of this. Yeah, and the new genetics. Yeah, new genetics. What new genetics? New ethics. New genetics. You may read these questions. Today we may treat some genetic diseases by transplantation of genome, but we doesn't do this because it's not legally. Yeah? We may treat some problem with blood, yeah, from on English, I'm sorry, not frequently used this term. Yeah, when the blood doesn't have some factors to coagulation. Yeah, we may treat this disease, but it's not legally. It's a question of new genetic. Yeah. The next point of our discipline is resource allocation. Yeah, I tell you about resource allocation in COVID pandemic. Yeah, when we doesn't have artificial apparatus, when we doesn't have a mask, when we doesn't have any medical clothes, yeah, when we doesn't have transport to transplantation our or translocation our patients from one hospital to another. It's a huge problem in all countries from pandemic. Yeah, it's a question of resource allocation. And after 1 year, we wait a vaccine of COVID and think that it's a huge growth of our situation, and we stop this pandemic. but have another ethic problem. Some citizens think that it's not morality do vaccination because it's confused our rights from freedom. And in all country it's a acute problem, and today we see in our country one half of citizen vaccinated, another doesn't do vaccine. It's a problem because the virus continue to disseminate it, and at this step when we create a vaccine and start to disseminate it, this distribution, this the question of resource allocation at the first. Yeah, what country must do? We may sell this vaccine outside of country or stay from internal needs of this country, what we must do. Yeah, and pharmacological company may have more salary from export of vaccine. Yeah, and it's laws and ethics problem of government countries. Yeah, organ transplant, it's we tell about this doctor-patient relationship. It's a bioethics problem, yeah, and medical psychology problem. We have this practice in third course. It's interesting term, and I say some word about this because we start our course and we do a first step in medicine, and we may sorry. Да, 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 если надо, да. Ну, я лекцию читаю, Марин. And on the first year of education, we see on situation in medicine that we understand the doctor must communicate it with many people, with patient, and we may think that it's not for me. I doesn't want communicate with many people, with patients. It's not not simple for me, but it's a doctor's skills. Yeah? Communication is one of doctor skills. Yeah? And all country are learning of this. How we must communicate. It's a check sheet. What we must say on this step, on this, on this. It's a skills. You may know about this, and we come to us to learning this on third course. Yeah, and the last question about experimentation with human subject and animals. Yeah, we touch these questions. Yeah, in your education. Yeah. See on this question some aspect of bioethics. Example of our situation, and you see this example of bioetic problem. Yeah. Yeah, this question, yeah, respiration, look on this. We have a criteria on blood, chemical structure of blood, when we start artificial lung function, yeah, about respiratory problem, and when we must stop this, and it's a reason of death of patient, or we must continue to support this function. For example, it's a case of great scientists. He was died 1 year ago. Stephen Hawking. Yeah, he have a disease of nerves, neuromuscular disease. Its name BAS. Боковой амиотрофический склероз, yes, BAS, abbreviation. And mind is working, but body doesn't move, yeah, because on stage of nerves function and muscle have a problem, and this from time of living, this level is upper and upper, and on sometimes patient doesn't do a respiratory movement, yeah, and what we must do, we understand in medicine, all medical understand that each patient will die, and what time of this, what time from the support of this life, yeah, when we must stop this support it, yeah? It's important question. Yeah, the next question about vegetative states. Yeah, vegetative states. It's maybe same, and in level of brain, we doesn't have a clear criteria who prognosis come to conscious these patients or not. It's not simple question. We have a good program to analyze this situation, but it's on this time it's scientific instrument. Yeah. When we must do a very good scan of a brain and very hard mass analysis of this activity, and we count communications from many areas of brain to each other, and create some index. And on this index, we may hypothesize that these patients come to conscious or no. Yeah? And it's a very hard process. Yeah? In practice, we see that conscious is not available, and this vegetative states. And I see this patient, it's not simple situation. It's not simple to relative of this patient, because it's a body without movement. But when some hygienic action do, patients may move some arm, body, yeah? My patient may react of some words. In sometimes relatives said that I think that my daughter come to a conscious. For example, I remember my cases when I treat these patients after car accident and damage of brain at vegetative states, 3 years mother have care from her daughter, 27 years old, with children, school children. And what we must do in this situation? We take a hope to come to conscious of this patient or not? What criteria of this? In our city, it doesn't. We doesn't have this opportunity. And what we must do? We must support this life, or say that it's not. We doesn't have any mechanisms to treat this patient. Yeah, it's not simple questions in our practice. Yeah. Yes, it's same there. It's next questions. Yeah, look on this sheet of questions. It's about prenatal babies questions. It's one of our branch because it's the same technical progress in this area. Take a chance to support a life from a fetus with little time of living. Yeah? From 20 weeks we may have opportunity to support this life. But in one, you see in this slide, in one babies, it's maybe a serious defect in organism, yeah, from internal organ, from some problem with eyes, with heart, with brain. And what we must do with this people, with this child, we must support continue to life, or say that it's not right. Yeah, it's not simple decision. Yeah? And in, for example, I said about this, in our country, many count of doctors in this situation said that it's a not living organism. Creating new children. Yeah, you are a young woman. We have a chance to have a normal child. Yeah? And in Europe countries, for example, in USA, you know that it's normal children, but with some aspect. These children doesn't have opportunity to think, to move. Yeah, some problem with it, for example, and but it's one citizen of our society, and what we must do with this, we must support this family with this problem. Yeah, it's questions of our practice. Yeah, it's pregnant problem and pre-birth problem. Yeah, and you see this abbreviation, national intensive care units. Yeah, it's a standard of treatment of these children. And in 5 course we learn this and come to a hospital, see these children, yeah, small little children in QS, in capsula with good environment to support these children to continue to live in this situation. Yeah. What's the main idea of Potter and general questions of bioethics? Yeah. what the this aspect that not all there is technically possible is morally right. Yeah, it's I say a large sentence of this. Yeah, because it's Russian scientists create this hypothesis about technical ethic growth in all branch of knowledge. Yeah, we have a balance of ethic and technique in society. Who will interested of this, we may type a work of Akop Pagosovich Nazaretian. It's the name, first name of this scientist, Nazaretian. Yeah. And the scientists, it's international scientists, create this hypothesis and give mass analysis of this situation. Yeah. In all society, we have a balance of technical progress and morality rights in morality standard in this society. And for example, in the World War II, the crisis of this, because the moral standards not big and technical progress will have a level up in progress, and we create an atomic bomb. Yeah, and moral standard not stopped the use of this in Hiroshima, and we have a huge problem in our history. Yeah? And this theory in our medical using located in bioethics. Yeah? What we must think about this problem. We have a technical achievement and we have a moral standard. And moral standard press this growth in medicine. Yeah? And another aspect, for example, in medicine today we have a problem with very extensive push of pharmacological company to use some drugs. Yeah, but morality rights of doctors, of our patients, said that it's not good practice. And we create some medical standards or guidelines to treat some diseases. And pharmacological company push her opinion, her commercial aspect of this. And for example, you see this in growth of antidepressant therapy all over the world. For example, in the United Kingdom, 1/2 of all population treated by antidepressant. Today we see articles where discussed morality right to treat antidepressant without diagnosis of depression. Yeah, think about this. If some people think that my internal world not good, I feel that this world not fine. I want to come to a doctor and took some drugs. And my internal world stayed in a fine step. It's aspect discussed, yeah, treated without diagnosis, and you see that it's big morality problem in society, yeah, about abusing of drugs, and about suicide of this treatment, because we may know that it's one of side effect of treatment of antidepressant. Yes, suicide problem, and its morality standard and push of dissemination of distribution of this drug of pharmacological company. And doctors stay on this crossing problem, and we may take decision on this aspect, what we must do in all this. Yeah. Okay, it's bioetic aspect of our practice, and I understand that in this time you think that it's not touch me in my life, in my practice, but I think that it's your fail in think, because one aspect of your medical practice, it's many time of practice. You have many year when all day on your consultation come people, and we take many decision, and one time of months, yes, half yes, we have a hard problem on your consultation, on your practice, and we must take a hard decision. And if you think about ethic aspect, we prophylactated your burnout syndrome, because we may think about different variant of decision and search only one most right decision in this situation. And you understand that we think about all decision, because when doctors look short on situation and took simple decision of this situation, on your mind we have this feeling and think about this situation, and all time this case come to your conscious, and we think about this 1 years earlier, 2 years earlier, 5, 10 years earlier. We remember this situation and think about this, what we must do in it right. Yeah, it's aspect of working of our mind, and it's one reason of burnout syndrome in medicine. And it's not simple to bring this knowledge in your mind, in your practice, yeah, because our discipline touch with problem of safety of life, yeah, and it's not simple, not simple situation, yeah. And all doctors in practice have this aspect, yeah. And it's like named home task. I think that's not your home task. You may read about this. It's another not great, not important, but very interesting historic fact about the reason of born of bioethic, yeah. You see that about first about very interesting, and we have a film of this patient, how we fight with poliomyelite, yeah. Vaccine trials, polio vaccine trials, yeah. It interesting, yeah. Thalidomide we talk about Scribner God Committee, yeah, of Seattle, first heart transplantation, yeah. Harvard Community's report, it's describe a problem of vegetative status and coma patient. You see this all of this aspect. This interesting historic fact about Karen Kwanlan decision, its a name I may speech not well, and another aspect, and we must plus 2020 HIV pandemic situation. It's 1990 in last century, and 2020 about COVID pandemic situation. It's fact that we discuss about this in our classes. Okay. Dear students, we have practice with one of all format. I speak you here. We doesn't have opportunity to communicate it. And I think that's all today. We have a good day to think about ethic aspect of medicine, about your future professional. I think it will be interesting our course, and I'm glad to see all our participants in our practice. Be attentively. Our next lecture on 26th of January in